Well, good morning, everyone, and can I say Happy Nursing Week 2012. Just a little bit about Holland Bloorview has been using the RNAO best practice guidelines for many years. And so it was no surprise 3 years ago when the opportunity arose to become a best practice spotlight organization that Holland Bloorview dove in typical Holland Bloorview fashion and applied to be a candidate. Our focus has been on 4 guidelines. 1, client and family-centered care. Another, strengthening and supporting families through expected and unexpected life events, collaborative practice among nursing teams, and the assessment and management of pain, which you'll hear a little bit more from Nick. We chose these guidelines because they support client and family-centered care and give evidence-based recommendations. This is a fundamental goal and is embedded in our strategic plan, using evidence to support outstanding client and family outcomes. Over the past 3 years, we've had multiple people leading the implementation of best practices, including Kim Krog, who has led our client and family-centered care, Anna DeMambro, who has led our collaborative practice amongst nursing teams with the Nursing Practice Committee, and Nick, who has led the assessment and management of pain guideline. We've also had great direction from our steering committee, and we were able to gain momentum and clinical change through best practice champions. Our nurses are not only involved in implementing guidelines, but as you can see around the room, many of the nurses are involved in the development of guidelines. Currently, Andrea Lozan, one of our NPs from the outpatient clinic, is working on the Transitions in Care panel. Nick is sitting on the revision panel for the pain guideline, and Kim is working with a group of nurses to revise and update the collaborative practice among nurses guideline. This whole experience has built capacity in nursing leadership and research at Holland Bloorview. We've participated in a provincial longitudinal study looking at the sustainability of implementation of guidelines with the University of Ottawa, including researchers Barbara Davies, Catherine Higuchi, along with our own Shauna Kingsnorth. There are many people to thank in our journey to this achievement today, and that is the RNAO, the Ministry of Health and Long-Term Care, the Bloorview Research Institute, Decision Support, thank you Vivek, and Information Systems. Without their cooperation, the incredible progress that we've made would not have been possible. I'd like to now introduce Doris Grinsman, the CEO of the Registered Nurses Association of Ontario and the founder of the Best Practice Guideline program. Thank you, Doris.